everyone, welcome to Nurse Pro. This is a channel helping you to pass your OSCE to get your nursing license. So I'm focusing on the adults 10 station. Today I'm going to introduce the framework of the OSCE. It could be used in all the procedural skill stations so that if you remember the whole framework, then you can perform your skill stations smoothly and you can tell the examiner that you know all the key points. So first of all, I would like to state that this channel is just for sharing purpose, and why we need to do a lot of steps that may not be mentioned in your marking scheme, that is not correct. So you need to read your marking scheme. At the very last point, you will see they were asking you to show you're professional. You're demonstrating your professional values, the standard of course, and also your professional behavior. So that's why a framework is something that helps you to show the examiner that you get the points. You are professional, and it will also help you to do the procedure smoothly, and then you will remember all the points more easily. So do familiar with the framework, and for every skill station is really very useful. And then besides, this is the framework that I introduced to you, but at the same time it is highly recommended that you use your own words to perform your skill station, and also you can arrange your own sequence that would make you to remember all the steps more easily. If you don't violate your marking schemes or some important key steps or key sequence, then it would be fine. So it is really highly recommended that you arrange your own sequence, you choose your own words to do the skill station. And lastly, you must check the latest marking scheme. So what I'm talking about is the version 1.9. So every few months the NMC may update their guidelines, they may update the marking schemes. So that's why you need to check the latest marking scheme before your exam. And if there are any extra point added in the marking scheme, then you need to do it, you need to perform it, and you need to show the examiner you know the point. So for the core, it is very important. Prioritize people, practice effectively, preserve safety, promote professionalism and trust. So what do you mean by frameworks? It's actually general steps for all procedural skill stations. It is a useful framework that helps you to do your skill station more smoothly. So first of all, before approaching patients, and then you approach your patients, and then you need to state the aim of coming, and then you need to prepare for your specific task, and then you need to complete the task that's given to you. And then you also need to state the task-specific education, the health education to the patients. And then you need to reassure the patients. And finally, you do a well ending. So before approaching patients, I keen on to try to remember things in a 3-points technique. For this one, before you approach patients, you remember there are 3 points that you need to fulfill. Number 1 is the environmental safety and clutter-free. So that is just like you're performing your basic life support, the first point you need to check is the environmental safety. So that's why you need to remember it. I'm sure that now the environment is safe so that I can carry out the procedure, right? And the next one, clutter-free, means there's no obstacle on the floor, and there's nothing that would increase patients' fall risk. So therefore, this is the number 1 point that you need to do before everything. Okay? And the number 2 is to maintain privacy and dignity. So for example, you may be given different scenarios, maybe in the hospital or in the community. If you are in the hospital, so you make sure you need to close the curtain to ensure patient's privacy and dignity. And if you're in a community, let's say if you're at the patient's home, then you need to close the door to maintain the same purpose. And then you need to do the hand hygiene. For the hand hygiene, it's very important that you do the complete 7 steps according to the WHO guidelines. So this is very important, especially the first time that you do the hand hygiene. You need to show to your examiner that you understand and you will do it completely correct. yeah, you won't miss any steps of the hand hygiene. So for the 7 steps, is palm to palm, back of hands, fingers interlaced, fingers interlocked, thumb, tips of fingers, and wrist. So actually there are a lot of posters, so like this one. This is released by the NHS. So to tell you how to perform the hand hygiene, you need the hair alcohol rub, and then you need to palm to palm. You do it like picture number 2, and then picture number 3 is doing the back of hand. At the same time, you're doing the finger interlaced, but at the back of the hand, okay? And then number 4 is the palm to palm, finger interlaced, yeah? And then number 5 is the fingers interlocked, just like holding a fist. And then number 6 is the thumb. You need to rub your thumb, rotational movements. And then number 7, you need to rub the tips of the fingers in a circular motion. And then number 8, you need to rub the wrist. Number 9, you need to wait until all the alcohol evaporates. Number 10 is stated that the whole procedure should take 15 to 30 seconds. Okay. So after you completed these 3, environmental safety, no fall risk for patients, and also maintain dignity, privacy for the patients, and then hand hygiene. Then we come to approach patients. This time we really come to the patients. So another 3 points that you need to remember. Number 1 is greeting. You say hi to the patients, and then you do the self-introduction. Hello, this is blah blah blah. Alright? And also it is very common and very polite that you need to ask the patients, how would you like to be called? How shall I call you? So you need to know the patient's preference. Okay? And then for number 2, you need to state the aim of coming. For this one, you just need to state a very short sentence to state the aim. Otherwise, the patients will not know why you're coming today, what's the purpose. So this is very important that I just use a short sentence to tell you what the aims of today. And then number 3 is check identity. Because this is a very critical point. If you finish all the procedure but you haven't checked the patient's name, this is 100% incorrect, right? So it is very important that before we do all the procedures, we need to check, we need to ensure that this is the patients that we want. So therefore, after you just use a short sentence to state the aim, you quickly check the identity. Don't miss this critical point. And then if you are in the hospital, remember to check name, dates of birth, and as well as the hospital number. It should be checked with the patient's wristband. And then for community, you need to check the name, the dates of birth, and also the full address. So after that, I really come to state the aim. So what do I mean? Do I have to repeat it all over again? Yeah, but you need to do it more detailedly, yeah? But before that, remember we have just checked the bracelets to check the hospital number of the patients. So at the same time, you will see a white wristband or a red wristband. This color will remind you to ask allergy, okay? So first you need to check the allergy, ask the patient if you know you got any allergy. Remember for allergens, this is not only restricted to medication. There are a lot of different types of things that would cause allergy of patients. So therefore you need to ask them all. Are you allergic to any medication, food, latex, and dressing materials? Because these 4 points is very important. This could be happened in the hospital. So we don't want to give a wrong medication for the patients. We don't want to give a food to the patients that would cause food allergy, right? And then we don't want to use latex if the patient is allergic to latex, because many gloves got latex, okay? And then for dressing materials, we don't want to give the dressing materials to patients during the dressing procedure, all right? And then next, we also need to understand if the patients know what will happen if he touches those materials or if he eats, if he takes that medication. So you also need to ask what will happen if you take it, if you have it, if you touch it, okay? So you need to check the allergic reactions. So actually you will be given a paper you will give them a question paper that you need to see if the patient's answer is exactly the same with what written on your paper, alright? But after that, after you checked the allergy, you check the wristband is in correct color, and you check that all the information is correct, you need to give patients reassurance. You need to tell the patients that we won't give this. Let's say the patient is allergic to penicillin, then you need to tell the patients that we won't give penicillin to you. We know that you are allergic to penicillin. Therefore, we won't give this to you. You don't have to worry, alright? Something like this. This is a simple wordings that you can reassure the patients that we won't cause you allergy, okay? So again, you must check if the wristband is having the correct color. If it's yes, then it is really good. But if it's not, then you need to tell the patients that I'm going to change the wristband for you, alright? So then, after we check the wristband things, we check the allergic history, then we come to restate the aim and gain consent. So you remember during the last stage, during the previous stages, we have already stated we used a short sentence to tell the patients the purpose of comment, right? So this time we restate the aim, but more details, give more details about the procedure. You could also say something about the procedure, that what will happen and what we have to do, so the patients will have better idea of what's going on. And then you need to gain consent, because patients got his right and to refuse your procedure, right? So therefore, we must gain consent before we proceed to the procedure. So we need to state the aim, gain consent, explain in more detail, and get the consent to proceed. And then for check comfort, we need to tell the patients how long will it take. So the patient will have a psychological preparedness for the procedure. At the same time, we should ask if the patient needs to go to the toilet, go to the bathroom, before the procedure, because some procedure may take 20 minutes. So if the patient is having some urgency, then it's time for the patients to settle it first before the procedure, alright? So we need to check the physical preparedness of the patient. And also we need to check the positioning. So we need to ensure that the patient is comfortable with his position now. And also there are some specific positioning for specific procedure. So let's say if you are going to give the inhaler medication to the patients, then the patients need to sit upright, not lying flat, right? So that's why this is the point that we have to check if the patient is having the correct positioning. If not, we could do it now. It is the great opportunities for you to assist the patients in a right position for the procedure. Therefore, it is a good timing. So when also you need to ensure that after the patient is in the correct position for the procedure, you need to ensure the comfort. You need to ask, are you comfortable with your position now? Are you comfortable with this position now? Alright? And then, so normally after this, we need to leave the patients for a while. But before that, remember, we need to offer some support to the patients. So actually, why do we have to leave the patients? It is because we need to go to prepare for the task. We need to get the equipment, we need to get what we want. For example, if we are giving the medication, then we need to get the medication, right? So if you are going to leave the patients, then leave a call bell to the patients. You can tell the patient that, here's a leave your call bell. Just press the call bell if you need any help, and I will be back, and I will come to you, and I will come to assist you. Alright, so just pick the sentences that you like, and then you need to give a call bell. Very important. And then, but if you are in a community, what should we do? You should tell patients, if you need anything, just give me a shout. And because you are at patient's home, actually you are not far away. You are just maybe just the next corner to prepare for the equipment. So just ask the patients to give a shout, and then I will come back to help you, to assist you. Alright? So after that, you leave the patients. You remember to do the hand hygiene. Alright? So now we look at all the steps here. We have gone through the before, approaching patients, approach patients, and state the aim. Now we come to the purple part. These three parts are prepare for the task, complete the task, and task-specific education. I highlighted them in purple because these are task-specific things. Then I have to go over these things one by one in different videos, because this video is just a general one telling you the framework of doing all the procedure. Alright, so after these you need to watch the video for specific task. But generally, let's see, for this one, prepare for the task. Normally we need to gather the equipment, and then we need to check prescription if you are giving medication. Alright, so and then we need to check the 5 rights: right patient, right drug, right dosage, right date, time, frequency, and also right routes. These are very crucial, so we need to check all the prescription, ensure the prescription is eligible, as well as complete before you give medication. And then after you gathered all the equipment and also you have get the medication, then you return to the patient and to do the task, to complete the task. So, and after you complete the task, it is very important that you need to document all these things. Otherwise, you complete the task, you didn't sign the record, then you fail the station. Alright? So for the documentation task, remember, especially for those tasks giving medication, you need to sign. You use initial would be fine. If the question paper has asked you to write the day and time, then remember to write it down. Alright? And then we need to do some task-specific documentation. For example, if you are doing a full rate, then there are some specific answer sheet that you need to write down the patient's reading regarding the 3 different readings. Alright? Just an example. And then next is the care plan. This is not a written one, but as to remember, it is very normal that after we have completed a procedure, it is really normal for us to state that we will formulate a care plan or we update a care plan, etc. So it's just verbally to tell the examiner that after you have completed all the answer sheets, then you can just simply state that I will also update the care plan. Yeah, this is a very good practice because it shows that you are giving the holistic care to the patients, and also you are showing that you're a professional. Alright? For the task-specific education, for example, there are some tasks that you need to do some tests for the patients. For example, urinalysis, then you need to report the results to the patients and you need to act accordingly. For example, you find some leukocytes, some red blood cells in the urinalysis, it may indicate infection, then you need to tell the patient about the findings. At the same time, you need to escalate to the doctor, you will tell the findings, I will talk with the doctor about your results, something like this. And then you can give some health educations. For example, you may say, I will suggest you to drink more water to ensure that you are well hydrated. Alright? Something like this. So it is something task-specific education that you need to give to your patient. So after that, here we come to the final two steps. One is to reassure the patient. So for reassuring the patients, because you have completed the task and you are going to leave the patient, right? So you should ask patient, are you comfortable? Do you have anything that you feel discomfort during the procedure? You need to ensure that the patient is comfortable after the procedure, alright? And at the same time, you need to ask, are there anything that I can help you before I leave? So you can see if there is any concern that the patient wants to tell you, alright? So, and also, for your task, if there are some, if the patient needs some follow-up, then you may stay here. And before you leave the patient, you remember, give a call back if you are in the hospital. If the patient is in the hospital, is it in the community, then you need to tell the patient to find his GP, his or her GP, and also to go to the emergency department in case of emergency, alright? Then we come to the ending. So before you end a task, quickly think about it. Have you all done? For example, if you suddenly remember that you forgot to tell patients something, maybe one kind of education then remember to tell it now before you read the ends, okay? Then is the waste disposal. So for example, you may be wearing the gloves and aprons, then you need to discard it into the clinical waste bin, and then followed by your hand hygiene, all right? And then also you need to clean the equipment. It's very common that we will use a tray to hold our equipment. So tell the examiner that I will clean the tray and make it ready for next use. Or you can say I will disinfect the tray with alcohol wipes and let it ready for next use. Okay, yes, these are the frameworks that I would like to introduce to all of you. So if you remember the whole framework, it is very easy for you to remember all the important points one by one without panic, okay? And then also, while you are doing your first few steps, it is actually giving you some time to think of your later steps, okay? So you find more time, and at the same time you are showing to the examiner that you are confident, you are professional, and you can remember all the steps. You can demonstrate all the steps, all right? So I hope this video is useful for all of you, and if you like this video, please subscribe and click the like button, and please watch other videos, and I hope that all these videos can help you to pass your OSCE successfully. All right, see you in the next video. Goodbye.